Colorectal cancer rates have declined over the past few decades, driven by more screenings and changing lifestyle-related risk factors. However, this trend is mostly in older adults. According to the American Cancer Society, those under the age of 50 are experiencing an increase in colorectal cancer diagnoses, but also an increase in colorectal cancer deaths. With me today is Dr. Sabrina Kidd, a colon and rectal surgeon here at St. Luke's. Thank you for joining us during Colorectal Cancer Awareness Month. We appreciate it.
Thanks for having me, Dan.
Dr. Kidd, I want to ask you first, are you seeing this rise in colorectal cancers in younger adults?
Yes, we definitely are seeing a rise in colorectal cancer rates in those under 50. And unfortunately, we're also seeing many of these patients be as young as 20 or 30 years old. And in addition to that, many of these cancers are more advanced in these young individuals.
That's good to know for those under the age of 50. What factors might be contributing to this trend in younger adults?
We think the biggest factor is actually our diets. The Western diet probably plays a large role in the development of colon and rectal cancer. And what we mean by that is inflammatory foods. Anything that's a processed food, red meat, high sugar foods, those things are inflammatory foods and may increase your risk of colorectal cancer. Another factor may be obesity. We also see increased risk in those that have a higher alcohol consumption.
What are some signs that someone might need to talk with their doctor about getting screened?
First and foremost, blood with your stool. It might be something simple like hemorrhoids, but you don't want to miss this as a sign of something larger like a colorectal cancer. Any blood in your stool, get it checked out, let your physician examine you and go from there. Other signs that may be a little bit more subtle could be things like weight loss, fatigue, or a change in your stool habits. If anything doesn't add up, again, please talk to your physician. You might need to be screened.
Good to know. Screenings are the best way to catch cancer early and help improve patient outcomes. What are the current guidelines for a screening colonoscopy?
A colonoscopy does remain the gold standard for screening for colorectal cancer, and in recent years, that age at which we start screening has actually gone down. We now start at age 45 for those that are average or low-risk individuals, and if you have a family history of colorectal cancer or of advanced polyps, you may need to be screened even earlier than that. So it's really important to talk with your family physician and figure out when the best time to start screening is for you.
Dr. Kidd, we see more and more at-home tests, and I want to know, are these beneficial for people to use, or is it best to stick with a screening colonoscopy?
Those at-home tests have come a long way, actually. They're much better than they used to be, and if they're abnormal, you may still need a colonoscopy done, but it's a good test for those that are average risk or low risk and do not have a family history or a personal history of polyps.
What are the latest developments in colorectal cancer treatment?
We've made a lot of strides in the world of surgery. We now do most of our colorectal cancer surgeries minimally invasively, which means either laparoscopically or robotically. This means through smaller incisions, the recovery time is less and the outcomes are usually better. We've also continued to study and made improvements in what we call multimodality therapy. And what we mean by that is combining chemotherapy, radiation, and surgery to treat the cancer. And when we use all of these modalities together, the outcomes are often better. And over time, we've actually decreased the side effects by combining modalities as well.
Is there anything else you'd like to add today for our viewers during Colorectal Cancer Awareness Month?
I cannot emphasize enough that it is really, really important to get screened. Do not ignore symptoms. By the time that you have symptoms, the cancer is usually more advanced. And actually, about 85% of cancers are found in people who do not have a family history of colon and rectal cancer. So it is really important for those that are of average risk to not ignore their symptoms and to get screened early.
Dr. Kidd, thank you so much for joining us. We really appreciate it.
Thank you.
To learn more about St. Luke's Gastrointestinal Cancer Program, go to stlukeskc.org/GI Cancer. You can also find updates on other health news at stlukeskc.org/news. Thanks for watching. We'll see you next time on Health News You Can Use.